Greetings, panelists and participants. My name is Karen Tinyari, an intern at the Coalition for Women's Health in Africa, and I'd like to welcome you all to this virtual official side event on the sidelines of the CPHIA 2023 that is happening in Lusaka, Zambia. The side event is organized by the Coalition for Women's Health in Africa, and our theme for the session will be the role of the private sector in advancing women's health in Africa. To start off, I would like to highlight some guidelines for the session. Attendees will be on mute during the session. We are recording the session, and it will be live streamed. It is also being live streamed on the Africa Health Business YouTube channel. For any questions that you may have, please post them in the Q&A section. We will try to respond to them by the end of the session. This session will last for 2 hours, and it will be in English. To highlight the session agenda, we have 5 panelists, 1 moderator and 4 speakers, all drawn from private and non-state organizations, just to ensure that we have a diverse range of perspectives on the topic. The program will be, we will start off with a slight introduction into the Coalition for Women's Health in Africa, which will be done by Esther. Then we will do an overview of the general data on women's health in Africa. Then this will open up the discussions into the current role of the private sector in advancing women's health in Africa. We'll get to hear from the different speakers what their organizations are doing. And then we will dive into the health policies in Africa and how the health policy shaping and the importance of engaging the private sector in the same, just to enable a good environment for women's health in Africa. We will also identify opportunities and needs for the private sector to initiate change within the health system building blocks of the WHO. We will then open up to a Q&A where we will respond to your questions. And then the session will end with the moderator and the speakers sharing their highlights for the session. And then closing remarks will be done by Esther. I'd now like to hand over the session to Esther Reiter, our project manager, COWHA. Esther, take over. Thank you.
Thank you very much for that introduction, Karen. So yeah, my name is Esther Reiter. I'm a midwife by training with more than 10 years of clinical experience in both private and public health facilities. I'm currently working at Africa Health Business as the project manager for the Coalition for Women's Health in Africa. As this is an official CPHIA site session, which is on breaking barriers and repositioning Africa in the health architecture, I would like to give a little bit of an introduction about the coalition itself to show why we are hosting it here. So the Coalition for Women's Health in Africa is a unified platform where we are joining private and public partnerships to create unified goals to establish sustainable, effective solutions in health to enable women's and girls' health in Africa. But where is it coming from? So basically, last year, Africa Health Business held its Africa Health Business Symposium, as it does every year, and it was on the role of the private sector in advancing women's health. This was very much established to be more important than a one-day event, and so a continuous event should happen, and that's where the inception of the Coalition for Women's Health happened, together with the principal founding member Organon, Hologic, and BD, together with Africa Health Business. So they really pushed this coalition forward. How does the coalition work? We basically work on 3 focus countries, even though we are committed, obviously, to reach more than those 3 focus countries, but to have effective results, we're working currently on 3 focus countries, Ghana, Kenya, and South Africa. And we're working around 3 pillars, knowledge and research, awareness, policy, and dialogue, and action. And this also is implemented within the technical working groups that we are holding to create sustainable solutions. So the technical working groups have 3 different focus themes at the moment. In the inception phase, it is cancers, sexual reproductive health, and non-communicable diseases. A lot of people will say, yeah, but cancers are non-communicable diseases. As we're all aware, breast and cervical cancer are very high on the agenda in Africa and a huge burden for women and girls in Africa. So they have their own technical working group. And then past inception phase, which will be past next year, we will also implement the technical working group, maternal newborn health. Now, what do we do in those technical working groups? We are trying to create sustainable and effective solutions to advance these health issues. Basically, this is what we are doing with the coalition, together with private and public partners, and of course also with the Ministry of Health and of these different countries, to create sustainable solutions. This is basically what the coalition does. I would love to hand it over now to Dr. Abebe. Dr. Abebe is basically has 20 years of experience, works for MSI Reproductive Choices. He has more than 20-year experience in large-scale public healthcare programs in Africa. And since July 2020, Dr. Abebe is working as the country director for MSI Ethiopia Reproductive Choices. And before that, he served for Mary Stopes Zimbabwe as a country director and chief of party for USAID project from 2016 to 2020. Dr. Abebe has also served as an associate director for the US Peace Corps Ethiopia office, a team leader and project manager for Intra Health and USAID, and a senior program officer for Action Aid Ethiopia's community-based health and gender program. Currently, he also serves as a governing board member for the FP 2030 Global Partnership. And Dr. Abebe has an extensive experience in leading the private sector engagement program in Ethiopia and Zimbabwe. Dr. Abebe held experience in leading the private sector engagement program in Ethiopia and Zimbabwe. Abebe held a doctorate degree in business management specialized in health, and an MBA specialized in health management, a BSc degree in health science, and an advanced diploma in comprehensive nursing. Dr. Abebe will be our moderator today, and I please welcome him all. Dr. Abebe, I'm giving the session to you to introduce our speakers and to lead the session. Thank you for your time today, and wishing you a good discussion.
Great. Thank you very much, Esther, and participants. Good evening, good morning, good afternoon, depends on where you are. So for the coming 2 hours, we are going to discuss very critical, very strategic, very important subject matter, which is, the importance of the private sector in order to advance the women health in Africa context, because in most countries, private sector are flourishing, but we don't know whether we are using them to the level of their potential. So today I have a wonderful, very experienced, knowledgeable speakers who are going to give us their expertise and experience, and then they will walk us through on the subject matter which we have tried to address. So my first speaker will be Mokadi Mashashi, Director of Access Markets for Organon, South Africa, and South SS for Organon. Mokadi Mashashi, Director Access Market at Organon SA, which she is responsible for access business policy and ACG in 34 markets within Africa. She has over 25 years of experience in healthcare spanning across public sector, private sector, academia, pharmaceuticals industry. She serves on Organon's South Africa Board of Directors. And then her experience continue. Mokadi holds a BSc in dietetics from Mudusuna or now Sefako Magato University. Postgraduate diploma in business management with business school. Business leadership program from Duke University and professional business coaching. She is currently studying towards an MSc and global health policy through London School of Hygiene and Tropical medicine. So she has such a wonderful experience, and then she will tell us what's happening when it comes to the private sector. So my second speaker will be Nyawari Nijuru, Director of Market Access and Partnership, Middle East and Africa, or Hologic. She's a healthcare executive with over 20 years of experience gained from various positions held in the pharmaceuticals and medical technology, diagnostics industry engagements, and programs on HIV, tuberculosis, healthcare workforce safety, and women health. She is an admin of the Women Leadership Program led by Stellenbosch University of South Africa. Nyawari is currently the Director of Market Access and Partnership for Middle East and Africa at Hologic. Hologic's spokesperson in Africa and a member of Global Board of Healthcare Business Association. This is what her experience looked like. Very exciting, very inspiring. Definitely, she will give us, a wonderful experience about, the private sector engagement within her role, responsibility, and experience. My third speaker will be Sarah Joy Malaba. She's the Chief Impact Officer on TICO or Trigrass. She is a seasonal leader in public health. She has over 17 years of planning and executives ambitious initiatives in Africa spanning from HIV, community health, digital health, reproductive maternal and child health, adolescents and young people, private and public sector interventions. She has exceptional talent in initiating and in cementing strategic partnership with funders, nonprofit organizations, and government agencies. She works as the Chief Impact Officer at Trigrass, where she leads global operations across 6 countries, overseeing marketing, the funder portfolio, as well as monitoring, evaluation, research, and learning. She previously worked at Population Service International, Living Goals, Partners for Health and Development in Africa, and global communities. So I'm very much pleased to see Sarah has such a wonderful experience, background, that she will give us again a wonderful experience about the subject matter that we are going to discuss shortly. The last but not the least, my fourth speaker will be Rosefield, a marketing access director for AstraZeneca Pharmaceuticals Limited in South Africa. She leads the strategic direction of AstraZeneca's access strategy for the AstraZeneca portfolio, which includes health economics, pricing and reimbursement, as well as corporate affairs. She focused on therapeutic areas, oncology, cardiovascular, diabetes, respiratory, immunology, and rare disease. She is project lead for AstraZeneca's vaccine project in South Africa, project lead, Facamisa project, and AstraZeneca non-communicable disease (NCD) CCR project, and Pharma's Luga Ambitions Alliance Cost for Inaction projects. During her extensive over 25 years of experience in pharmaceutical industry, spanning several high impact positions, Rose has been instrumental in developing and implementing innovative access solutions, achieving optimal pricing, reimbursements, other access conditions, as well as securing high-level government affairs and engagement. She also leads community and projects that promote disease prevention, awareness, and education. So this is Rose. So we have a wonderful 4 speakers, and then we're going to see what they're going to share for us on the subject matter that we are going to discuss. Ladies and gentlemen, in this discussion, we are going to have some objective which I would like to share. The first important thing is, for participants and stakeholders to gain valuable insight and knowledge on the role of the private sector in advancing women health. What is happening in our continent and what needs to be happen. So we are going to discuss on such kind of things. So this is one of the objectives that I'm going to underline. The second objective will be to for attendance to understand the private sector's point of view on women health. Women health is very crucial and very critical for advancement of our continent. So to what extent, our private sector are playing a role. So we want to give that kind of understanding. The third session the same objective would be for the sessions to generate concrete ideas and solutions to address specific challenges or issues in the private-public sector partnership. Private-public partnership is one of the strategic direction in Africa. Where are we now? Are we maximizing that opportunity? What are the challenges? What needs to be done differently in order to improve and advance the well-being and health of African women through such kind of platform? The fourth one is both participants and policymakers to gain awareness around the role of private sectors in advancing women's health. Africa, how collaboration creates sustainability. Now we are going to discuss and reach our horizon, our understanding. How can we ensure sustainability by fostering a value-added collaboration? So these are the major objectives. So from this, based on these major objectives, what are those key areas for discussion? We are going to discuss, factors and findings of the private sectors enabling the environment and women health. So this is one of the areas that we're going to cover. The health policy shaping in the private sectors, identifying opportunities and need for the private sector to initiate changes. Basically, we are going to touch, or we are going to use the six healthcare system building block of WHO: service delivery, health workforce, information, medical production, vaccine technology, financing, and leadership and governance. All the topics that we are going to discuss, all the issues that we're going to discuss in one another way rests on these critical six pillars of WHO. So I think before I give the floor to my speakers, let me walk through what is happening, where are we, and how the women's health in Africa looks like. So what are the top health issues that affect women in Africa? We believe women can play a pivotal role in socio-economic development in Africa context, but we need to be very strategic in order to build Africa. We have to invest in women's health. So on top of that, what are the top health issues that are affecting women in Africa? As you know, cancer is one of the major problems that undermining the health and well-being of an African woman. The second one is family planning. Family planning is a very important instrument to advance the health and well-being of women. So in one other way, this is affecting their health. The third one is maternal and newborn health, and the fourth one is non-communicable disease. Of all problems that undermine the rights and well-being and health of women, these are the major four problems that really jeopardizing and putting women in Africa at risk. Let's see what the magnitude look like. For example, when you see the cancer, the cervical cancer, we have two types of major cancers, as I mentioned earlier, which are affecting women's health. The first one is cervical cancer, and the second one is breast cancer. When you see the cervical cancer, when you see the overall incidence is around 10.6% in Africa context. The death toll and the death prevalence is around 10.8%, which is near to 11%. So this is in one another way unacceptable for us if we want to uplift and advance the women's health in Africa. So the most important thing is the breast cancer. Its incidence around 16.8%, and when it comes to the deaths, it's around 12.1%. So in general, breast cancer survival rates in Africa are significantly lower than in Europe. 5 years survival is only 40% in Sub-Saharan Africa compared to 80% in high-income countries. Once women diagnosed in cancer, their survival is not, 40% only in 5 years. The rest in the Europe and elsewhere, out of Africa, 8%. So we can see how the inequity, and how vulnerability affecting our women in Africa. So this is one of the major problems. When it comes to family planning, as I mentioned to you, it is a right issue for women. It's an important tool, an important element to advance and keep women in the school and keep women just to participate in socio-economic and political affairs. However, this is still a problem that jeopardize their health. And around 257 million women are globally lack of safe contraceptives. This is unmet need. That means they are predisposed for unintended pregnancy. That means they are predisposed for unsafe abortion that might lead them to death. So Sub-Saharan Africa has the highest unmet need, which is 25% of women affected. If you want to see women play a role in Africa development, this is area that we have to work on. When you see the comparison, let me give you two countries. For example, in Kenya, the sexual active adolescents are 40%. Modern contraceptive, use in married women is 58%. When you see Ghana, 57% are, are sexual active Adolescent, when we see the modern contraceptive use is 30%, still there are some disparities. Still, there's a huge gaps when it comes to family planning in Africa context. The last one is maternal and maternal mortality ratio in sub-Saharan Africa. It is an estimated 319 women will die in childbirth for every 1,000 live births by 2030. This is again unacceptable. This is a wake-up call for us. How can we help our women to live the decent life? If we want to see that, definitely we have to bridge that gaps. So this is more than 5 times above the 2030 Sustainable Development Goals. Sustainable Development set a target, but where we are right now, we are not going to reach. We are in 2030, still the maternal mortality will be higher than what is expected on SDGs, which is 70 maternal deaths per 1,000 labor. SDGs requires countries not to just to bring the maternal mortality 17 out of 100,000, but when we see in Africa context is much, much higher than that. The infant mortality is another area, which stands around 27 per 1,000 live births. 46% of global newborn disease happening in Africa context. This is far above, again, the target of fewer than 25 days per, 25 days per 1,000 live births. So in general, within Africa, Nigeria is the ones leading with high maternal mortality rate, which is around 1,047 per 1,000 live births. So this is what it looks like. The lowest it might be in Southern Africa, which is 127. And Kenya and Ghana also, they have also a huge maternal mortality. Of course, Ghana is around 26.3, but in one another way, in Africa, the maternal mortality is very high, which is again a wake-up call for us who are advocating for the women's health. Non-communicable disease is also another area that undermining the health and well-being of women in Africa. So the recent data indicate that the non-communicable disease results in 41 million deaths annually. 17 million people are succumbed to NCDs before the age of 17. 86% of premature NCD-related deaths occur in low and middle-income countries, basically in Africa context. So in general, the leading cause are cardiovascular disease, also another area, cancer, chronic respiratory disease with 4.1 million, and diabetes, including kidney disease, deaths which are around 2 million annually. In general, what are those gaps that we want to see? I mean, we want to address. The most important is data. Data is very important things. But as we are speaking right now, the last report on women's health by WHO was published in 2012. So this is something that requires quick action, and we have to advocate for this. The second is an awareness. The status of women's health is not always clear among stakeholders. Where we are, what's happening, how can we address such kind of awareness is not as such consistent and harmonized in African stakeholders. The other and the most and the critical component is investment. What do women want really? Without clarity of the needs of women, it is impossible to know what to do, where to do, how to invest. So data, awareness, investment are the other critical pillars as an African that we need to address. So this is areas that we are going to discuss and elaborate a little bit. For finally, the notable action that we need to be taken is increased investment in the health system. The health systems requires a huge investment because, as I've tried to mention earlier, investment is one of the lacking areas. So we need to invest on that. The second important thing is increased discussion about women's need by institutions such as African Union, what African women want. We want to flag and we have to advocate when we have to raise the women's need in order to bring the type of services, type of investment that needs to advance women's health in Africa. The most important and the other one is more participation of women in political decision making. Women are not only a recipient. Women can play a greater role to improve, to advance African agenda forward. If that's the case, definitely we have to bring as many women as possible in the parliament in Africa and in our respective countries. For example, this is an improvement. For example, in 70% 22 in Rwanda, which is one of the front runner when it comes to women participation in the parliament. South Africa around 46%, Senegal 41%, and my country is 38%. So there is a big improvement when it comes to representation. But we need to do more than this because women need more investment, more attention, more involvement. If we do all those things, definitely we advance women in order to advance Africa. So, having said this, with this background, now it is a floor for my speakers just to give us and to walk us through their experience on the subject matter, which I've tried to elaborate. My first question is for Mokadi from Organo. So, are you ready?
Yes,
Great.
I am.
Super. So Organon has a specific focus on women health. We know that what Organon is just specific. We know what Organon is doing really. Organon has specific focus on women health. Can you please elaborate on the key areas within women's health that Organon is prioritizing? What are those priority areas that Organon is doing within your framework in addressing in women's health? And what unique contributions your company bring to this space and reduce inequality? Over to you.
Thank you so much, Dr. Abebe, and good afternoon, ladies and gentlemen. I also first, before I go into that, just pause and say, I think it's quite admirable as well that as we sit here on this panel, it's a panel of women discussing women's issues in Africa. So this is really a great indication that truly we are intentional about focusing on women's health. So in terms of Organon, when we launched in June 2021, we launched more than a company. We launched a commitment, and our commitment was that we are committed to women, that we ensure that we contribute to creating a better and a healthier every day for every woman. And we are deeply rooted in the understanding that when women rise, everybody rises. And this speaks to what you've just mentioned as well, Dr. Abebe. We also understand that when women are healthy and empowered, so are their families and their communities. And we are really committed to empowering gender equality and equity, and also ensuring that we can achieve that very vision that I've mentioned. Our aspiration as an organization is to truly impact women's health from birth, menarche through to menopause, but also beyond. And through the portfolio of products that we have in established brands and also in biosimilars, we focus on diseases that disproportionately affect women. And these include pain. You've alluded to some of them: cardiovascular diseases, dermatological conditions, cancers as well. And on our women's health portfolio in particular, which is our largest offering in terms of solutions, we provide women with products that will enable them to exercise their power of choice in terms of when, how, and if they want to have children. So in terms of our unique contributions, we have made a commitment last year through the FP 2030 to contribute to preventing 120 million unintended pregnancies across the globe. And based on the stats that you've just shared now, Dr. Abebe, we're also mindful that majority of that is on the African continent. And by preventing these unintended pregnancies, we will be enabling women to stay focused on their growth and be able to fully unleash their potential and contribute meaningfully, not only in the communities that they are in, but also in spaces where decisions are made. We have a vision to also contribute to reducing maternal mortality, looking at PPH in particular, which again disproportionately impacts women on the African continent. And we are also about amplifying women's voices. You've just asked the question as well, what do women want? And who better to answer that question than women, right? So women empowerment is really key. And we can only achieve this by providing spaces where women are listened to, heard, and then we act on what we are hearing from the women, and also ensuring that women are in those positions where they can contribute to the decision making. We have an access program that supports capacity building, health literacy, health strengthening projects. And we've worked with many of the stakeholders that are on the panel, but also some that are, operating on the African continent. And currently, we are working on novel mechanisms to ensure that healthcare can be financed. Because one of the pressing issues in Africa is around how do we minimize so much dependency on donor funding and ensure that we create healthcare systems that are sustainable. And you also asked around the issue of gender inequalities. So as I stand here today, I stand proud because Organon South Africa and Sub-Saharan Africa, when we launched with a 70% female representation on our senior leadership team and across our workforce as well. And that trend continues. And it's a trend that continues across the entire organization as well. And then if we look at our ESG strategy in particular, we are focused exactly on addressing inequalities and, as I say, because charity does begin at home. So we have an initiative called Her Promise is Her Plan, and that is intended to support initiatives that also include women empowerment outside of the healthcare space. And when I talk about there's multiple stakeholders that we work with, it's not only in healthcare, right? There's also a need to engage other sectors as well. If you look at facilities, those are things that are dealt with by the infrastructure department, for example. And in order for things to work, we need to ensure that they are also on the table. Finance holds the strings to the purse. And unless the policies around the allocation of funds is taking into account what we are solving for, then it will continuously remain an issue. And there's a need for involvement of technology, teams as well to ensure that we can amplify digital and take the lessons that we've learned from COVID-19 and continue to refine and expand our reach in the healthcare space. Thank you so much.
Excellent. Thank you very much. It's very, very inspiring one. Definitely will enrich later on in our final discussion. Okay, let me proceed to my second speaker. In just Niwara Nijuru. I'm going to ask a question that, Holijik is known as for its focus on women's health technology. So how has Holijik really contributed to the advancement in diagnostic and imaging technology for women, and what impact has this had on early detection and treatment? This is more of your experience, your contribution, how to use technology for the betterment of women, particularly on early detection and treatments. So over to you.
Great. Thank you very much, Dr. Abebe, and thank you, Mohadi, for really painting the picture of how we as private sector, having a mutual vision and goal, are coming together in collaboration under COWHA to begin to drive the advancement of women's health on the continent. So Dr. Abebe, just reflecting quickly on the statistics that you shared. I mean, I see these statistics very often, but it's still so shocking for me every time I imagine that 1 out of 5 women today on the continent diagnosed with breast cancer will die within 5 years. It's really tragic. And honestly, the only way we can begin to change that is very simple, is beginning to focus on the early diagnosis, early treatment, so we can begin to improve the quality of life and also improve the opportunity and chance of survivorship. And really, this is what is driving Hologic and what we do. Our whole purpose is really centered around on how can we ensure we get patients getting into care very much earlier through our technologies, but also addressing some of the gaps that have been identified by WHO when you look at the building blocks for health system strengthening. In particular, the piece on data, and going back and looking at, we have data that dates back to 2012 from WHO. We as Hologic did invest into what we call the Hologic Global Women's Health Index, which really is a window that allows us to learn more on where the pain points are for women, and then leverage on that data to begin to build the innovations and health investments that we need to drive that forward. So just briefly about Hologic, and I don't know how much of you, many of you know what we do. When we think about cervical cancer, really we have been at the forefront of ensuring that we can get early diagnostics, really bundling together molecular solutions and the best-in-class cytology to ensure that we can get early diagnosis of cervical cancer. And we are heavily investing in that science, moving from what we had as our basic and adding on digital cytology, one, to improve the early diagnostics, secondly, to also increase access to key competencies of pathologists that we lack within the continent. Sometimes the reason we have delays in diagnostics is because we don't have clinicians. But by adding digital cytology to our currently existing technologies, then we are really increasing the opportunity and chance that we will be able to get an accurate diagnosis at the very first point when we do meet these women in our healthcare systems. The second key investment has been in breast cancer, which really is something that we all can be working towards. And we continue to look at breast cancer, not in isolation, simply as diagnostics, but really looking at it from the whole continuum of risk assessment, diagnostics, biopsy, moving into breast surgery, and supporting the women when they do go through their key therapies as well. So that continuum of care for us is really where we see we can make a change, because we look at the patient journey and build those investments that really significantly will begin to improve the well-being and the outcomes of our patients. The other thing we don't normally talk about, and every time I'm thinking about it, Esther, we probably need to begin to think about abnormal uterine bleeding and heavy menstrual bleeding. These two things truly do affect women, but we don't really talk about it because more often than not, women are not reporting it because of the shame it brings. But it does cause immense mental stress, emotional suffering, but much more is directly related to a lot of what we see in women in terms of maternal mortality. The more you bleed, you become anemic. By the time you're getting pregnant, the outcomes are not always very best for a mother as well as the child. Again, at Hologic, we are heavily investing in that space to ensure that, one, we provide those solutions from a surgery point of view that enable doctors to, in a very good way, address abnormal uterine bleeding, heavy menstrual bleeding, still protecting the integrity of the uterus and allowing the woman to be able to live through her menarche years and be able to bear her children and live what I would call a holistic life. But I think where we truly move the needle is really where we are filling in the gaps on data, creating awareness in the community through partners, and also working through stakeholders and governments, because we alone and technology on its own cannot really make that change that we want to achieve, Dr. Abebe. I won't rest it there, but really open it up to say the more collaborative we become, the more we can make technology more pervasive and permeative within our communities.
Thank you, Noara. While you are there, just would you give me just for my follow-up question within 1 minute? So, in what ways does Hologic collaborate, with healthcare providers and an organization in Africa to ensure the adoption of innovative technology for women? Because having technology by itself means nothing unless we have someone to use it for its purpose. So, how your collaboration with healthcare providers in Africa, particularly in adopting that important technology for women health?
Absolutely. So really being cognizant of the fact that Africa is one continent that's heavily dependent on donors and that cost is always an issue. Back in 2018, we launched what we call our Global Access Initiative. And within this Global Access Initiative or project, the whole goal was to say, how do we partner with donors, with stakeholders in health and governments of health to be able to bring these technologies into the country at a cost that would be more affordable and that would reach many more people. At that particular point in time in 2018, we were looking at HIV, which disproportionately affects women, but we've gone ahead to add HPV for cervical cancer screening and gone ahead to also add vaginal health. So looking at sexually transmitted infections, which heavily affect women. So through what we call our all-inclusive pricing, which means we provide you with not just the technology, we provide service, we provide education, and we also provide monitoring and evaluation that helps us evaluate the project, we are able to bring those solutions and technologies to the continent, to governments at what we'd call an affordable price, and to be able to increase access to some of those technologies. Beyond the technologies, Dr. Abebe, we are also investing in education as well. We've had a real good project in Zambia, partnering on educating healthcare workers on cervical cancer screening, not just on HPV, which is our molecular forte, but looking at all types of screening methodologies that we need to be able to empower the healthcare workers to be able to screen women when they see them at the very first time. And we continue to look at partnerships to continue to expand some of those models for us to be able to reach more people and improve access to diagnostics and testing.
Excellent. Great. Thank you very much for sharing your experience. Hopefully, participant might have some question later on, then you will elaborate further on your experience. Thank you for that. Now, my third speaker from AstraZeneca, Rose Field. I personally am quite familiar with AstraZeneca after the COVID. I don't know whether I know that company before or not, but most of the people knows. So when I'm talking about AstraZeneca, we have some kind of attachment anyways. So my question for you is, AstraZeneca has, a global presence in pharmaceuticals industry. So can you share your specific initiatives or programs that AstraZeneca has implemented to address women's health needs in different regions, particularly in Africa? Because we're talking about African women, I want to get your experience, how AstraZeneca is doing on these issues. Over to you, Ruth.
Thank you, Dr. Abebe. I think I will take it a step back, and then I will say, in terms of women's health, what exactly does women's health mean? And in terms of the insights that we've received from the different women is that some people see it as spending time with family. Others, they see it as exercising and eating healthy. Others, getting enough sleep so they can make it to work the following day. Others is being well and healthy for longer, so they may see their grandchildren grow, and maybe not missing a checkup and just being able to access healthcare. So health means different things to different people. And we also know that the problems that affect women are many, and they're complex and they're diverse. And the biggest driver of those problems is socio-economic inequities. So when one wants to come up with solutions or programs that actually address those issues, it needs to be more than a program. It needs to be something that is sustainable. It needs to be something that talks to what is happening on the ground, that is localized, that is practical. And it needs to be something that actually brings outcomes that are measurable and then that make a difference to the individual. So in terms of the programs that we participate in and that we work in, we make sure that they are very diverse and they're very inclusive. So in that diversity and inclusivity, we work with governments, civil society, academia, the community. And when you're talking about the community, it's not just the community members as in patients or as in households. It's also about the traditional leaders. It's about even traditional healers, because they are also part of the healthcare system. So whatever we do in the community needs to actually help to feed into the outcomes that we want to get at the end. So one of the programs that we have at AstraZeneca is Phakamisa, which means uplifting people. It's a Zulu word, which means upliftment. It's got 3 pillars. And the first pillar looks at the education and the awareness that happens in the community. We need to make sure that when the person is still a person before they are a patient, before they are sick, how can we get to help them to prevent that disease? How can we help them to make sure that they actually don't get to a stage where they become sick? So that program is very key in addressing that. We also want to make sure that when a patient has got the disease, how do we help in terms of getting early detection? Because most of the time, when we look at the outcomes, the differences, in South Africa, we've got a 2-tier system. We've got private sector and we've got public sector. And most of the time, we find that in the private sector, the outcomes are much better. And the question is always why? And we find that most of the time, it's actually because of the timelines when the patient actually gets into the healthcare system. So the earlier they get, the quicker they get into the healthcare system, the quicker they get that diagnosis, the quicker they get that treatment, then the outcomes are much better. So early detection is quite important. And if community members don't know what to look for, and they don't know the symptoms, and they don't know that something could be wrong, and they need to get into their first point of entry, which most of the time is clinics, or a GP, if it's private practice, they will not get there early. And when they get into the practice, what happens there? So what we do with that program is that in the communities, it's about healthcare awareness, about education. It's also about making sure that there are points of care where people can actually get those services in partnership with the other decision makers to drive those patients early into the healthcare system. But then the second pillar addresses the capabilities of of the healthcare workers and also the healthcare community workers, because the healthcare community workers mainly work in the communities and the healthcare workers are normally in the institutions. So the capability building then says, if a patient gets into the system, what kind of service are they going to get? And what is available in terms of resourcing? So we partner with institutions, we partner whether it's private or government to make sure that those capabilities are there. I'll give an example just to make it more practical. In South Africa, what we've done, we've partnered with National Department of Health to educate oncology nurses in the districts and the tertiary institutions. The tertiary institutions, they are not usually well educated, and the capabilities are much higher. But if you look at the policy, it actually advocates a hub and spoke model. So you need to actually be having a lot of the community members going into the district hospitals first. But it's actually the other way around. It's almost like an upside down funnel. So how do you prevent that? By building capabilities at the district level. So we then partnered the National Department of Health and an NGO called the Breast Cases for Courses for Nurses. They did the education of the nurses, and it was actually across the 6 provinces. And those 6 provinces have got oncology services or partial oncology services. We wanted to make sure that they know how to they know what to look out for, but they also know how to treat and also how to diagnose cancer, or how to navigate those people in the system so that they're not lost to follow up. It is a project that we then made sure that it was also accredited by the Stellenbosch University over 6 months. So that capability building was very important, and we see that it's actually yielding outcomes. Then the other thing is to then look at the access side to say, what are the things that we can do together with the stakeholders to basically increase access? So I think you'll see in the other countries, when there was the COVID vaccine program, that we had the mobile clinics. We wanted to make sure that the healthcare goes to the people instead of the other way around. So those are some of the programs that we're having on the ground in terms of making a difference to the patient and making sure that it actually addresses the needs of women most of the time, because most of the patients in these areas are women, because of the therapeutic areas that we are looking at, which is your breast cancer and also your ovarian cancer. There are other cancers that also affect women and other areas that affect women, like your lung cancer. We also have diabetes. We also have respiratory issues. But the biggest majority of the people, it's women, and it's also because they come in late because of other issues that they have in terms of their responsibilities.
Great. So thank you very much, Rose. Definitely, we're going to have more questions might be on your excellent and your experience on what your organization is doing. So my next question is coming to Sarah to trigress. My excuse in case I not spell the word trigress. I think I thought I'm correct. Trigress. For Sarah, my question for you is: trigress is involved in behavioral change initiative, and then I know they are here in Ethiopia as well, have that information basically. So could you provide examples how your organization trigress use technology, to drive positive behavioral change in women's health, and then what are the success that you have observed by using technology for the behavioral change in vis-a-vis to women's health in Africa? So do you have anything that you can share to us as a success?
Thank you very much, Dr. Abebe. Good morning, good afternoon, everyone. It's a privilege for me to speak to you about the work that we do at Triggerize. And we're basically a service delivery organization. We talk about ourselves as being the next generation nonprofit that uses innovative technologies to ensure access to health services among adolescents and young people, and specifically adolescent girls and young women, speaking to the topic of the afternoon. So some of the ways that we use technology to ensure access, first and foremost, our technology platform is known as the TICO platform. So for you to be able to benefit from the services that TICO is able to deliver, or Triggerize is able to deliver, a young person gets enrolled into the platform using a QR coded card if they don't have a phone. They can also get enrolled onto the platform using an SMS or a WhatsApp, depending on whether they have a feature phone or a WhatsApp phone. Once they have become a TICO member in that way, in that form of enrollment, we use technology to enable them to have access to a pool of service providers that includes both private and public sector facilities, where they will be able to access quality assured and youth-friendly services that range from sexual reproductive health, HIV services, mental health, and in some countries also access to skills building, including employability interventions that they would require. Through this platform, then, young people who are able to enroll via phone, either by SMS or WhatsApp, are able to get onto a self-service kind of platform where they can access information and also access service delivery points. Those on phone, again, receive nudges and reminders so that they are supported through their journey around starting their health journey, continuing on it, and, continuing on to conclude on it, or ensure repeated service delivery depending on what service of choice they have. So having talked about technology, then I also want to be clear that we try to ensure that we do not continue to create a digital divide that, continues to funnel inequitability. So our behavior change communication work includes both in-person and digital follow-ups, so that, young people who are not able to access technology or access the platform through technology can have in-person support through community-based organization, peer-led organizations, young people in their communities that they can speak to about their health choices, their health needs, and can direct them to referral points. I also want to conclude with the fact that young people on our platform, being a TICO member, then allows us to use technology to reward them in form of loyalty points once they have made a decision to access services. So for every successful service access, they gain loyalty points, which then they can use to redeem at a local retail shop. This way, we continue to nudge them. We use loyalty points as a way of nudging them to continuously come back for services. Some of the big successes that we have seen is that we have seen to date more than 2.2 million young people have been able to access the services that we provide through this platform approach. What we have also then seen is that through technology, we are also able to support young people to start and continue their journey. We see, increased rates of continuation on family planning, for example. We see increased rates of return for HIV prevention services and treatment services. We have seen a continued increase of uptake even on mental health services, which are critical for young women in Africa. And so these are some of the successes that we have seen, including being able to use technology to understand to what extent young people and young women are able to access integrated services. And we are able to account for young people and young women who are able to access more than one service through our platform. Thank you very much.
Great. Thank you, Sarah. I think what you have mentioned is amazing. And I think technology is the way to go. If you are talking about an adolescence underneath, we are talking about, technology. So would you tell us a little bit within a minute or less, how can technology and behavioral change intervention be effectively adapted to diverse cultural contexts in Africa and ensuring relevance and impact in that case?
Thank you very much. So when we talk about adaptation, I think it starts with this big question that you also fronted when you are, creating the scenario for this webinar this afternoon. It starts with understanding the user, this adolescent girl and young woman. What are really their needs? How do they want those needs met? And, you know, when we talk about needs being met through a technological approach, we must understand their type of access and capabilities in as far as technology is concerned, in terms of also when and how they can access, you know, technology, and then also think about when they want to access these services and how they want to access them. Being user-centric then is extremely important when we talk about using technology for behavior change, because we want to be able to use technology to support users to overcome some of the barriers they have around health-seeking behaviors or barriers they have in terms of service access. And as I said, using a platform approach, we are able to provide our users, who are basically young people, access to both public and private services that they may otherwise not be able to access without an ecosystem approach that the platform that Triggerrise uses is able to afford them. So again, it is important that technology is fashioned in a way that enables users to start and continue on and maintain health-seeking behaviors and health choices that they choose to take. And then we also then need to tailor and allow for in-person and also tech-based approaches, thinking about not using technology to continue to create barriers and a digital divide, especially for disadvantaged and vulnerable youth who may not be able to access technology in the way that, you know, other populations are able to access. The other thing also, a key consideration, is to make this user journey, once you have a technological approach, seamless and easy for the young person. And you taking a user-centered approach enables, you know, the providers such as ourselves to be able to ensure that that journey is seamless. Thank you.
Thank you very much. Thank you very much. Very, very, very amazing experience. Okay, ladies and gentlemen, hope you are enjoying this session, and then we continue with our next round question. Particularly, my next question more of, you know, revolving around, you know, how policy, you know, shaping, you know, the importance of engaging the private sectors, particularly to create an enabling environment for women health. So I think with regard to that, let me forward my question to Niawira. I have two questions for you. You might elaborate this one based on your experience. So as you know, affordability is, you know, a critical factor in healthcare. So how can government and the private sector collaborate to ensure the affordability of, you know, essential women's health? So this is my first question. And the second one might be, what policies or incentives are required to encourage in private sectors? We know that mostly private sectors in some countries are evolving well, but in others is not. It is a missed opportunity. So in order to minimize this opportunity, really, what policies or incentives are required to encourage private sector to come into the system? And then to, you know, in the healthcare infrastructure, especially in underserved areas. So this might be two questions which I would like to pose to you, over to you, and then I will come back to the panel if time allows to give you reflection on this as well. Over to you, Niawira.
Great. Thank you very much, Dr. Abebe. And this is an extremely very complex question. So I hope I do have some health economists, right, as part of our attendees to really help us be able to break down. Because affordability is really a big piece. And I think it all goes back to looking at what are the barriers to affordability and linking this to the health financing pillar, which is part of the building blocks of WHO. So it's a very basic question to say, what are the true barriers, right, to affordability? And when we just reflect back, we know that most countries really have put health as a basic right, right? If you go to the Kenyan Constitution, for example, access to quality healthcare is my basic right. But for me to access healthcare, there needs to be financing for that healthcare. And the question is, what is the state of health financing across the African continent, whether it's from a private sector point of view or whether it is from a government point of view? If we think about what finance is available, and we can reflect on Africa in particular, how much money is available in our economy today to be able to finance basic health? Because without the financing bit, then again, we begin to say we are not able to purchase health, because we have to purchase health, whatever it is, right? The whole package of services, not just commodities or drugs that we would be talking about. So as we do know it today, and this is statistics available to all of us, most of African countries can barely be able to finance health for various reasons. We have countries with very small GDPs. We have competing priorities. Do we fund education? Do we fund infrastructure, right? which drives economic development, which essentially should then improve our ability to pay for health. Where do we put the few dollars that we are generating in the continent? Is it in health? Is it in other systems that also support the ecosystem that is health? The second piece is also around how we conduct or do procurements as well. How efficient are we? Are we fully utilizing the money that is also put out when we do have the little money that we are financing into health? And just to reflect a little bit here, I know this data, most of us do know it. In Africa, we bear 25% of the global burden of disease, but our health expenditure is only 3% of the global health expenditure. For 1.2 billion people with 25% of global burden of disease, we are only spending 3% of the global health expenditure. That number for me is staggering, because unless we can begin to say how much more can we put in health, whether it is from private sector or public sector, the question of affordability will always remain. So I want to flip this question a little bit, not just looking at affordability, but much more to look at how do we look at financing health, so that then we can begin to say how much money do we have in the basket to be able to provide healthcare, and then look at how private sector and public sector may collaborate in that space to ensure that once we have that money in this basket, then how do we firmly utilize that money? The second piece here, again, Dr. Abebe, and this is statistics that you also know, spending $78 per capita on health really is not money that can buy us any package of health. If you have seen, and we're talking about universal health coverage, most countries are still struggling to say, then what exactly can we fit into $78 today, right? To be able to buy meaningful health. What trade-offs do we need to be able to make, right? To be able to say, this is all we have, we still want to provide quality healthcare for our patients, what is that going to look like? And this does not just affect women, it's the broader health ecosystem to which women bear the biggest brunt, because more often than not, we do have some unique needs that are not always actually accounted for or budgeted for. I'm hearing of special funds for sanitary towels for girls in Kenya, and I do wonder, does that have to be a special fund, or is that something that we already entrench into our social protection policies or in our health policies, for example? Just looking at how we integrate some of that thought process. When we also think about poverty, which also has a significant factor to whether we can afford health or not, again, it becomes very complex when you talk about the amount of money and affordability of health. If I cannot afford basic food, essentially the pain in my leg is not that painful anymore. I will delay the pain in my leg to try and get food, and at the point at which I'm coming into hospital, whereas the $78 may have made sense, it no longer makes sense for me or for the service deliveries. I will be requiring probably double or triple of that. Again, those competing priorities on what we want to invest in make it significantly difficult to quickly answer the question of affordability and where we want to go to. So it's not just about affordability, but how do we increase investments in health so we can increase access to health, and then look at how we can integrate the private sector into that dialogue. Just before I delve into that, and as I was really thinking through this question, I came across a very interesting write-up that's been done by Michael Potasori and Robert Kaplan, and it was in the Harvard Business Review of September 2011. It's called The Big Idea, and I think it's very interesting for anybody interested in looking at how we can cost health and look at health financing. Whereas that case study was centered on the US, it basically reflects some of the things we need to be thinking around our health ecosystem to look at how we are costing health today, and then being able to build the models that help us be able to finance that. And a critical piece and gap I find today, Dr. Bebe, is we don't have a complete understanding of what cost in healthcare means. When we talk to private sector, we are only thinking about, if you come to industry, is the cost of drugs, is the cost of consumables, is the cost of technologies. While really, essentially, even though private sector may bring down the cost of drugs, if the inefficiencies within the whole healthcare system is not taken care of, the cost of financing health will still be higher and will not be affordable or reachable. So much more looking at it as an integrated system and not isolating it into the different pieces, which then essentially does not give us the benefit of really being able to provide affordable healthcare in this context. The other piece is looking at the different players who always have competing priorities, right? If we think of government and private sector and what we all want to achieve, sometimes we are never really moving in sync in terms of priorities, even when it comes to healthcare. politicians and policymakers, when they talk about reduction in costs, they're basically telling industry, please cut how much you charge in your hospital, cut how much you're charging in drugs. But they're not thinking about the R&D investments required to be able to bring good quality products, medicines into the market for us to ensure we can detect, diagnose early, give good treatment, and avoid the cycle where patients keep coming back to the healthcare system and therefore again increasing cost. So there is opportunity for us to sit at the table together with private sector and public sector and really begin to cost health, not cost technologies or commodities, and look at them as pieces for reimbursement, and then build this holistic channel that allows us to have full visibility on what affordability truly does mean. So on top of my mind, I think there's a whole place of process improvements that we can do, bring down some of the inefficiencies that we see. And I think this is where digital technologies are coming in. Sarah did talk about what they're doing on digital, educating on preventive and promotive health. There is a space there to look at what we can do around inefficiencies. We need to look at where we are duplicating as well, right? I have seen a lot of private sector and public sector hospitals. You have a public hospital, and less than a mile, you have a private hospital and have another private hospital. And all the three are trying to build centers of excellence, for example, diagnostic centers of excellence, all of them installing a CT and MRI machine. Do we need those three CT scans and MRI machines in a radius of 1.5 miles, for example? Are there opportunities for us to consolidate so that one, we can have economies of scale, but two, from a costing perspective, we can actually be able to have more patients and begin to improve the costing for the patient and affordability in that particular scenario. I see you have a question for me, Dr. Bebe, or something you want to interrogate.
Yeah, thank you very much, Nyawera. I think this is excellent elaboration, and then you have alluded very well. So I mean, for the interest of time, I will give might be for the rest of the panelists, I might be the speakers for one or two, just to give us if you have any specific regular framework that or incentives that can be put in place to encourage private sector engagement, especially in underserved area. So just I mean, we're going to take for this question. Mokadi, may I give this question to you? You are muted, Mokadi. Just unmute yourself.
Can you hear me?
Yes.
Yes, I think this is where, as Nyawera eloquently explained, that this is where partnership becomes absolutely critical, right? Because there is expertise in different sectors. And if we are joined in terms of resolving the issue, then it becomes less of a burden. So improving efficiencies becomes critical, the digital technology becomes critical. How do you optimize all of this, and how do we bring the youth as well into solving the challenges as we build forward?
Okay.
I think Dr. Bebe can just clarify on what Mokadi is saying. One critical piece for private sector is leadership and governance, which is one of the building blocks of WHO as well. When private sector has got a sense that the fiduciary duty of government is to provide an ecosystem that's the enabling business, and that we can have a level playing field, investments in that place become less risk averse, and private sector is willing to come to the table as well. So leadership and governance issues are very critical to attracting the private sector, and especially as we go further down to underserved communities.
Okay, great. Sarah?
Yeah, let me add my voice to this whole question around affordability and cost from the perspective of vulnerable young women, impoverished, in populations where, you could talk about the missing young women and the young women who may have barriers even around accessing what we may call free services. Because sometimes we think that when we talk about access through the public sector, we mean that it is more sustainable. However, we don't account for barriers around the cost of stigma, okay? The cost of actually accessing a free service that may mean, missing a market day to try and go for health service delivery. And from a triggerized perspective and from a development perspective, when you think about the role of private sector, then a big question for us, which is fully embedded in our model, is trying to use donor funding to fully subsidize for access for this type of women through the private sector. And so giving the private sector the opportunity to participate in a mixed health system that includes a public and private sector, but also enabling vulnerable and reached young women to actually exercise choice around what kind of facilities will best suit their needs. I think somebody has talked about the fact that we always think about private sector as having better quality. So we want the vulnerable young people also to have access to this better quality. And so the big question for us has always been, what is the role of innovative financing in enabling a subsidy model that works for the private sector to be able to serve some of these underserved communities, which otherwise will never be able to access the private sector higher quality kind of services. Thank you.
Great, thank you. Thank you, Sarah. Very much appreciated. So, Ruth, over to you. You raised your hand, yeah?
Yes, yes. So for me, in terms of, if you look at equitable healthcare, most of our medicines are based on precision technology, meaning that they are actually tailor-made for individual patients and also for targeted therapy. So it will be very important to actually have those medicines across the board for most of the people that actually require it. And for us to get there, the other things that we are looking at, and we are basically partnered with civil society and academia in terms of looking at the cost of not. So having economic studies to show the cost of not actually maybe funding for those medicines, the cost of not diagnosing for those, because sometimes upfront it looks like it's actually very expensive. But most of these costs are being caught up in terms of hospitalizations, in terms of these patients when they keep on coming for recurring therapies, in terms of the progression of the disease. So going forward is going to be very, very important to actually have that so that we can stop having a situation where the amount of money that you have actually determines the kind of therapy that you get and also determines the outcomes that you'll get and probably whether you actually live or die.
Excellent. Thank you. Thank you very much, Rose, for a more elaborative explanation on the topic. Mokadi, you raised your hand or the previous one?
Yes, I did. I've raised my hand, and this was just to follow up on the research piece, that there's a need to also incentivize research, because one of the gaps that exists in healthcare is we don't always have full representation, especially of patients from Africa in research. So if governments are also supportive of local research, local data generation, then that's an opportunity as well that will also help in shaping policies. And on this note, I think technologies like what Triggerize provides also provides us with insights, right? Data that can also be utilized as insights for shaping some of the policies, along with, what the Hologic also team has prioritized. So by listening in and then taking in those insights, that's how we can also make some of the policy shifts and improve engagements with governments.
Great, excellent. Thank you very much. So, Makadi, while you are there, let me start with you with another round of questions. That's more of focusing on opportunities, opportunities for the need of the private sector to initiate a change within the health system. So, particularly, we have discussed earlier in my presentation about the building blocks of WHO, taking that into consideration. Now let's talk about the opportunities and the need for the private sectors to initiate change within the health, the health system framework. So within this framework, my question for you is what role can private organizations play in advancing women's health? And how can partnership between the public and private sector to be strengthened? This might be one of the questions. The second might be it is interrelated question actually. In your view, how can the private sector actively contribute to address the financing gap in healthcare? Already you have mentioned, but a little bit less deep dive on addressing the financial gaps in healthcare. So what innovative mechanism, what financing system that really requires as a model?
Thank you so much. So in terms of how private sector can contribute, one of the key things would be sharing of some of the expertise and efficiencies that exist in private sector. And those can actually be utilized then to contribute to improve the health system in the public sector. And there's also a need for a balanced view of what public sector brings to the table and what private sector brings to the table as well. There is also a need for governance and leadership, as per what Nyawira has mentioned, that there's a lot of learnings and opportunity again for that exchange of learnings between the two sectors. And maybe we need to start looking at healthcare in a unified manner. Should we really be having that differentiated view of what is public health, what is private health, private sector? So again, there is that need to continuously reevaluate and rethink how we come up with solutions for healthcare. And then when it comes to innovative financing, so within Organon, we are currently experimenting with various models outside of Africa, though, but which we are anticipating will potentially also bring into the African space as well, where we're looking at things like blended financing. Could we maybe relook at how bonds are actually utilized? And is there a need also to be intentional in terms of ensuring that within the country's budget, there is an amount ring-fenced for healthcare? And those targets are measured, and there's accountability on that as well. But while we're also talking about ring fencing money for healthcare, there's a need also to further ring fence money for women's health in particular.
Okay, great. Yeah, new era?
No, just to reflect on to what Mokadi is saying, I think the one thing that's clear to us, Dr. Bebe, is that the private sector is willing and is ready to come to the table. And I think we have seen that we're looking at all the great investments made in health, also through all the venture capital firms coming to improve the health ecosystem that we have in Africa today. I think critical to that piece is really creating that enabling environment that brings in the private sector to play. The second piece to Mokadi's point of view is that private sector does have some special expertise. There may be some parts of the healthcare system delivery that government truly does not have to own, that they could actually let private sector play into because they do have the expertise and then be able to cover that and take it as a service. For example, the heavy logistics required to move product, commodities from one place to another in the country. Coca-Cola knows how to move Coke from the point of manufacture to the lowest level possible to any village. Are there opportunities for us to leverage that type of ecosystem and have private sector make investments there, which then takes away the intense capital investments required by government to build that holistic type of investment to support healthcare systems? So there are opportunities for collaboration in different spaces, and clearly being able to identify the different strengths between the different players where we could essentially be able to support. The other piece that I talked about donor funding, and I think there is a question for us to say as Africa, we need to begin to ask ourselves, if we are to stand on our own 2 feet, how much should we continue to rely on donors? And in which space and sphere do we want to play? And if I reflect on the new public health order, how do we build respectful partnerships really that are truly addressing what it is that we want and how and where we want it? So that's also a critical piece as we move into the years. A couple of countries in Africa moving into middle income, meaning that they will no longer be able to access the heavy donor funding, but they still need to be able to think about systems and financing models that still continue to support and enable them provide that healthcare as well.
Great. I think very important question regarding to the, for how long that we are going to depend on donor funding. The last might be 10, 20 years might be a comparative advantage for us, to bring as many donors as possible. But that comparative advantage may not be here for the next 10 or 25 or 10 years on what's happened in the future. So that requires some kind of strategic thinking, creating space. For example, in the MSI point of view, We used to be supported by donors earlier time, but now we have changed our model, that sustainable model that brings the private sector, to play a critical role, without relying 100% on donors. I think what you have mentioned is correct. Creating space is the most important thing. Is private sector has strong strengths in which we are not yet, harnessed it. So if we bring these things together, definitely we create, a big opportunity for us, for women, particularly to get the type of support, women deserve in Africa context. Yeah, so let me proceed to the next question to Sarah. Sarah, Tricres is keen to leverage technology, already you have mentioned earlier, particularly in providing choice for girls and women in Africa context. So could you please provide, how Tricres uses technology to increase service and product access among women, and what success have been observed? One thing, do you have any success that you want to share to us, and how Tricres is advancing using technology to provide choices? Now I'm talking about choice, technology, success, service uptake. All those things are something which is trying to link up with what you are trying to mention. So it's more of a follow-up question on what you have already mentioned earlier.
Yeah, absolutely.
And might be on top of that, you can give me something, how can the platform approach that Tricres use be effectively adapted to drive contexts, ensuring now critical but scale and impact? I talked quality, I talked, technology, service uptake. Within that framework, again, just tell about the scale and impact. Over to you, Sarah.
Yeah, thank you. So again, I'm going to recap and say that we use the technology, our technology, which we say we take a platform approach to ensure that, we create an ecosystem of multiple actors that include both the private and public sector. So when I talk about public, it's basically that, an adolescent girl and young woman can access services through the public sector. They may also access through a private clinic that may be franchised or non-franchised, and also access services through the pharmacy, especially talking about self-care products, that they may need. And so technology then enables us to create this ecosystem that enables the young person to access, and the young woman to access, different types of services when, where, and how they want to access them. So that means that we are able to create an ecosystem where you could choose to access services through brick and mortar kind of facilities that you walk into and go into. You may also be able to access services digitally or through some direct to consumer mechanisms where you make an order and you have that delivered to a place that is convenient to you as a young woman or a young person. The second part, in terms of how we are able to leverage technology to ensure access to products and services, which is critical to our model, is that we then use technology to be able to support our whole full subsidy model, where we are able to compensate private sector for the services that these adolescent girls and young women are able to access. And then by the power of technology, we are able to subsidize for services that we can fully verify for and account for. So really assure the donor that indeed the right young person has accessed the service that, the funds are being used to fully subsidize for. So some of the key successes that we have seen through this platform approach that creates a complementary ecosystem is that we are then able to ensure a good access to a mixed health system that also ensures better choices for these young people. And by doing that, then we are also able to overcome some of the supply chain challenges that come along, whether you talk about a shortage in private sector or a shortage in private sector. With this mixed health system, then this young person has an array of services they could access, and surmount some of the supply chain challenges that sometimes accompany, the health system. Using technology also, then we are able, big successes that we are able to ensure there's a connection between the supply and demand side. And when I talk about demand side, this is where we talk about using technology to drive behavior change, using technology to inform the young person, using technology to nudge the young person to continue on their journey, to remind them, when their appointments are due. And then that way we have created demand both for the public and the private sector that ensures that adolescents and young women are able to access services that normally they would not be able to access, whether because of time barriers or type of system barrier or product barriers or even the cost barrier. So when talking about, what it would take to adapt and to scale, the big items that we need to consider, which we have considered and are big successes for us, is that the technology needs to be able to be adaptable. So there has to be a way to be able to provide choices such as no-tech options, low technology options, and even high technology options. And, I could just give examples. For example, our work in South Africa, we think that there's a big opportunity to have high-tech solutions because the kind of young person in South Africa has access to a smartphone, has access to the internet. Then you have a setup such as Burkina Faso, where we must think about low-tech and even sometimes no-tech kind of solutions. When it comes to what faces the young person. So we have also built our technology around it's more facing on the provider side and more facing on creating the ecosystem rather than forcing the young people to be the ones that need to get onto the technology. As I said, they have an option to be enrolled and be a TICO member through a card. If they don't have a phone, if they have a feature phone, they can use an SMS system to be enrolled. If they have a smartphone, then they can use a WhatsApp, message to be enrolled on our system. So being able to build a system that doesn't create inequity and doesn't re-emphasize or reinforce the health inequalities that we see is extremely important. And with that, then you're able to deploy this adaptable technology to whatever ecosystem is available in that country and be able to ensure that the ecosystem that you create is able to create demand among the young people and the young women and actually link them to quality assured, youth-friendly service providers who are able to meet their health needs. Thank you.
Dr.
Sorry,
Abebe, you're on
Thank you
mute.
very much. Thank you very much for your elaboration. So, if anyone can add on that, as we welcome. I'm watching the time. I'm seeing the time. We are on track so far. So before I leave for question answer for the participants, now I will have one question, one more. Okay, Noari, you want to add something within
No,
within a minute,
absolutely.
1 minute?
Yeah, Sarah has covered this very well, and I love the way we are leveraging digital technology to be able to reach out, right, and really do preventive promotive health, which is where we need to go as we begin to manage affordability.
Yes, absolutely.
I think one critical piece that we need to layer here is when we think about tariffs on data, because the cost of data is becoming prohibitive, right, to be able to reach all these different groups. So again, looking at health as a complete ecosystem, with all these innovations we're bringing on board, how is government, the policies, right, behind the scenes really supporting and enabling that? Because the cost of data across Africa, honestly, is out through the roof compared to anywhere else I know in the world. And that's something significant we need to think about from an incentive or policy point of view that would continue to enable us to reach more people with digital health.
Great. Thank you very much. Thank you, Noari. So, Ruth, this is the final question, which I would like to address to you. So, would you tell us about the key issues that affecting women, as as far as healthcare concerned? Already, we have mentioned a lot of things. You guys, you alluded and you elaborated a wonderful experience. But now let's see what are the key issues that really affecting women as far as healthcare concerned. And the other important things, how can we, private sector partnership, build resilience? Because the future is uncertain. In the world that we are in, things are changing very quickly. So resilience is a very important thing. So from that point of view, how the private sector participates in building a resilient, sustainable healthcare system through partnership. Over to you, Rose.
Thank you, Dr. Bebe. So for me, it's very practical things. For example, one of the things that is a huge almost like a burden or maybe a barrier as well is language. So most women, it's very difficult for them to articulate themselves or to understand the healthcare practitioners, or to understand the delivery systems that are actually used and the tools that are used for them to learn about disease or to get awareness because of simple language barriers. So what we are doing as an organization and also with our partners is to try and make sure that most of these are actually translated in local languages. And if they are in local languages, we also want to make sure that in terms of the dialects that are spoken, they do understand that. So those partnerships are very important. It might look like something that is not directly related to health, but it is very important. And then the other things that is actually affects as well the women is in terms of transportation. We find that it's very difficult sometimes for them to get to the institutions, mainly because of financial constraints. So, I mean, I've got examples of certain hospitals where to get treatment, sometimes it will actually take them 11 days to and fro for them to be able to get whatever they require. So these are people that are sick. These are people that sometimes don't even have money, and they still need to have somebody to help them to get there. They need food to get there. So those things are quite issues. So what we've done, we've partnered with organizations that then provide the transportation. We provide the funding. They basically work with the institutions. One such organization is campaigning for cancer. They've got a project, a program that actually does that. So that is very important for women and also for males as well. But I mean, mainly in these areas, because of breast cancer and ovarian cancer, we are dealing with women. And then the other big thing as well is in terms of early detection. So what we've done, just to make sure that everything is quicker, we've got a partnership with MedSol. MedSol is a device that was produced, it's an artificial intelligence device that was produced or developed by a local scientist, a doctor, Dr. Catherine Malhebe from University of Pretoria. So what it does, they actually do screening at local clinics, and we're actually expanding that. And just to look at the outcomes, they have improved backlogs from about 6 months, I believe, to about 2 weeks. So it's something that is really making a huge difference, because then it means that the next steps, the diagnosis, the treatment actually become quicker, and then you actually have outcomes. And then the other thing that is actually what we see then that also affects women is that in terms of financial burden, we know that in most African countries, even though women are very active and they're doing stuff to basically bring food to the table, most of the time they're not financially independent. So it then creates a barrier in terms of their access with very good quality care or quality medicines or quality diagnostics. So we have got patient support programs where it acts as like a co-bridging for co-payments, etc., for them to be able to get treatments. That is very important. And those patient support programs also help with adherence as well. So there are so many interventions, but I think the important thing is to just make sure that along the patient journey from A to Z, we need those partnerships that can actually address all the touch points so that we can actually deliver good health outcomes and provide resilience to the healthcare system.
Great. Thank you, really. Thank you very much, Rose. You explained, what's happening and what's need to be happened from the question which I've asked you. So thank you very much for that. Now it is time for the panelists. I mean, not panelists, for the audience to ask a question. I really thank you very much, my panelists. You from your descriptions, we Africans, we are very rich in terms of a lot of things, the resources there. But what's needed is connecting the dots, particularly from the six building blocks of the healthcare system, strengthened from WHO framework. There are a lot of potentials, but knowing the potentials, bringing systems, building capacity, strong leadership, all those things that were mentioned is very critical. By doing that, definitely we are going to make a big difference in the well-being and lives of our African women. So now, thank you very much for your time. Still you are there, but now it's time for the audience to ask a question. With this, I will ask Esther to raise if there are any questions coming from the audience. Over to you, Esther. So we have still time. Then, yeah.
We have time for a few questions. Thank you, everyone, for this incredible, interesting discussion. It's been really, really nice to listen to you all. I captured some questions, so all of you have one question that I would like to give to you from the audience. I think I'm going to start with question 1 for Nyawera. The comment was, great thoughts around health financing. Are there potential scale-up models that are more sustainable in financing health? Is the continued view of health and social issue working against building sustainable models and looking at the health financing and health as a political and development issue? I think that's a lot. So I'm going to just capture that in the sense of, are there potential scale-up models that are more sustainable in financing health? I think that's a good question for you.
No, absolutely. And I go back to saying that health financing is truly a very complex issue, right? And there's multiple studies and trying to find what's the best framework that needs to happen. And I would say, as we have been working on universal health coverage, there's so many models being tested or piloted across the different countries. And we're all looking out to see which is that model that essentially we would say is a good space enough for us to be able to leverage or be able to roll out across different countries. If I reflect on that the big idea write-up was talking about that's done by Michael Porter, the one thing they have argued is 2 things. That one, there is nothing like free healthcare, and I hope you'll agree with me, because somebody has to pay for it. So we need to find the money on how to pay for it. And the second piece is around the cost, that by bringing down the cost of one part of healthcare does not mean that we can fully be able to finance healthcare. So looking at this whole holistic process of how do we, one, cost healthcare, and then be able to find the funding for that cost that we have already established. So it may take different forms. And I know the latest, and I call it the buzzword, is blended financing, right, into healthcare. And what that means is bringing in private sector investments into healthcare and saying which pieces of health service delivery or which component can private sector be able to invest in. Is it the capital side? Do we build and transfer type of models if it's hospitals, and be able to, have government build, operate and transfer type of models for us to bring in capital investments or build the infrastructure that we do require? I don't think we do have one fully tested model, but I do know we lean heavily on what the Nordics have done, looking at them as having what we call really successful healthcare models. But when you look at the GDPs and what money they're investing on health, it is triple, double what we are doing. I think on average in Europe, they spend about $4,000, $5,000 per capita on healthcare. We're at $190. It is way far out for us to be there. So I think will remain a challenge with our contracted GDPs, but there are opportunities for us to continue to look at the current ongoing pilots and then come up with a framework that could address that question better going forward. Not sure I've answered your question, because I don't think there's really one full model identified yet.
No, and I think it's a very wide question and a very complicated question. And thank you for your answer. I think it's helped a lot and gave some examples as well. Because of time, I'm just going to move on to the next question, and that one I'm going to give to Mokadi. I saw you mentioned that you would like to answer that one in the Q&A box. So, a major challenge exists in the form of unaffordable healthcare costs for women in numerous societies. It is widely acknowledged that prioritizing self-care is crucial to addressing this issue, particularly through early disease detection. This includes ensuring access to family planning, sexual and reproductive health services. What role do you play in advocating for self-care among policymakers? This encompasses making self-care kits ready, available, and facilitating its integration into the healthcare system. I think that's a very good question for you.
Thank you so much. Again, here, this is a key for partnerships, right? Because we can utilize technology to ensure that women are able to manage their own healthcare needs in terms of their sexual and reproductive healthcare. And part of this includes them being able to self-administer some of the medication as well, so that they actually can be able to manage the burdens that we've already highlighted in various aspects with regards to minimizing the number of trips that they have to go to the facilities. And some of this also includes providing long-acting contraceptive methods, right? Because that again manages to help in terms of how they are able to then access healthcare services. So there's definitely a need again for highlighting the benefits of this from an economic perspective with the policymakers to ensure that there is a bigger drive for self-care. And then also utilizing technologies. We have recently partnered with Triggerize or Tico to ensure that we can use digital platforms to drive for self-care. And there is also smartwatches that people would have access to, right? So that is also another thing that can be advocated for. And I fully agree that there's a need to engage the telecommunications industry to ensure that there can be consideration for providing potentially free data for healthcare, but maybe that's being way too ambitious. But maybe there's a need for engagement around how can we make data for health, for access to health innovations more accessible to more people. And I was recently shocked to learn that many women across the continent do not necessarily have access to the what is it to the internet. So how do we bring solutions that are also not only dependent on smartwatches and smartphones, but also anyone who has access to a cell phone can be able to utilize maybe a technology like the USSD platform to access information. So it's about empowering women in understanding what healthcare means to them, what their needs are, and how to clearly articulate that, but also know when to actually get care and how to get that solution in their hands for them to be able to access it more quickly.
Yeah. No, thank you very much. I knew that was a good question for you. Thank you very much for your answer. And of course, to all our attendees, it's a short time to give an answer. So if there's more questions that you would like answering, please send them to the Secretariat. We're happy to pass them on and get them answered. But to get to the next person, Sarah, I would like to give this question to you so that everyone has also a question, but especially with your innovative digital platform, I think this is a good question. There's a gap, especially on the sexual and reproductive health needs of the vulnerable population, trans women and adolescents, girls, street populations. What are we doing in increasing access, reducing discrimination and promoting inclusivity to quality healthcare, and advocating for enabling policies that safeguards the rights of key population when it comes to accessing quality healthcare? Of course, this is a difficult question, but I'm going to give that to you.
Yeah, thank you. I think I'm the right person for that question for sure, because we are a service delivery organization. And part of the reason why we have a digital approach is that we feel like it ensures privacy for this type of populations. I want then to say at this point that to get enrolled as a TICO member, all it requires is that you are classified or regarded as a young person between 15 to 24 years old, depending on the country that we are in. You need these services. You live in an urban or a peri-urban area. You are regarded as a mature minor. Maybe you're a married young person. You're a young person who's sexually active. You could be pregnant, or you could have faced sexual and gender-based violence. You're living under multidimensional poverty, and maybe you're also a key population member. So really, you are talking about young people, young women who are vulnerable. So one of the reasons why our platform approach really works for some of these populations is that it ensures their privacy, it ensures their confidentiality, and we only get 2 data points for you to be enrolled onto the TICO platform. Basically, your date of birth and your gender. Depending on how you define yourself, those are the only 2 data points that you need to be able to be enrolled onto the TICO platform. We don't need your name. We don't need your identification number, especially as you see, we have 15-year-olds that we are also targeting. So this ensures that, whoever we're enrolling onto our platform feels safe enough. They don't feel like we are taking too much data. We don't sell data, so they're assured about their privacy, their confidentiality, their data security, and, the TICO membership, all that it unlocks for them is access to these services that otherwise, would be unsafe for them. The other reason why our platform approach, also lends itself to this kinds of population is that we select and map service points that are already quality assured, with a level of, assurance around being stigma free, because we regularly check in with our users either through client exit interviews, allow them to rate the services they have received if they're on the phone, and they're not able to participate in an in-person client exit interview. So they give us a sense of, do they feel safe? Do they feel stigma free? Do they feel like they have choice? Do they feel like the service provider actually counseled them properly, for example, for contraceptive uptake? Did they feel like the service provider gave them the choice that they required? So these kinds of feedbacks embedded into the technology or into the approach helps us to weed out service providers who are, maybe regarded by young people or these vulnerable populations as being, with stigma or with biases of one kind or the other. We are also big on safeguarding, and so have provided toll-free numbers again for users to be able to call in and tell us if they feel unsafe. And in conclusion, I would also want to say that when thinking about key populations and the right-based approach, we have a lot of providers on our platform who are also community-led organizations or service delivery points, whether they're drop-in centers or key population-specific clinics. Those are also part and parcel of our ecosystem, so that we are able to provide these services and ensure access. Thank you.
And I think that shows, again, how digital technology can really create a difference in healthcare access and services. So, yeah, thank you very much for that. I know we are running towards the end. I'm just going to make sure that Ruth also has a question, which I think is perfectly up your alley. In these deliberations on the role of the private sector, it is important to clarify the roles and contributions that can be made by the for-profit and not-for-profit. Regarding the for-profit private sector, do we see an increasing role in the provision of tertiary and quaternary care, especially for non-communicable diseases such as cancers? Additionally, should we be considering private-public partner models? Thank you.
Is that for me, Esther?
That is for you.
Okay. So in terms of quaternary and tertiary partnerships, in terms of the care on the public sector, I think for most of the African countries, we see that there's always like two tiers of the healthcare system. You always have the private and you always have the public. So we find that most of our medicines, most of our care is actually in the private sector, even though we have some of the medicines, the older generation medicines in the public sector. That's not the ideal. So at the moment, we are busy working with governments, partner with governments, partnering with civil society, etc., to try and make sure that this care is actually across the private and the public sectors, and also getting to the rural areas as well. That's why earlier on, I alluded to the cost of inaction studies, to say if you've got cost of inaction studies, it's easier to actually put the costings and see that you are already spending that money that you think you are saving, especially in the government sector, because those patients, you're already paying for them. Where they come to you with complications, where they come to you with referrals, hospitalizations, etc., you are already paying for them. So it's important for us to do that. But what I'll also want to state is that I think for us, as private sector and also as civil society, it's very important to actually help governments in actually having investment cases. The investment cases will help them in actually putting money or reinvesting money together or putting budgets together for it to be sustainable, so that they're actually able to get innovations going, whether it's on the medication side, whether it's for diagnostics, etc. Because at the moment, it's usually that the frameworks do not accommodate innovation. So if they actually have a costing together and they can prove that there is a return on investment and that they actually cost savings in the long time, they'll be able to do that. But they cannot do that without a robust investment package. So we need to be able to help that. And I think it also comes back to Dr. Abebe's comment earlier on. He alluded to the fact that we don't want to create a situation where there's constant donations all the time. There's constant, projects coming from private sector, coming from civil society. No, we want a resilient system that is actually able to sustain itself going forward. So all these things that we have in the private sector, they need to be in the public sector. We actually need to get to a situation where we only have one tier system.
Thank you very much for that answer. That's well said. Dr. Abebe, I know we're coming to the end and we are coming to the summary of the discussion, but there is one more question that maybe you could add into your summary of the discussion. I'm going to just give it to you and then you can maybe add it into the summary of the discussion. But when it comes to the raising awareness on different ways to access quality healthcare, how do we create a conducive environment for the private sector to partner with health insurance companies to help those they are serving access their products and services? It's been established that it isn't possible to completely subsidize healthcare services, reducing the financial strain by encouraging people to turn to insurance. A combination of both will have a positive impact. How do we educate our people? That's the question. And I think that's with our people, I think we mean people within the continent or, yeah. Oh, Dr. Abebe, you're on mute.
Yeah, great.
Yeah.
So thank you very much. Before I summarize, what has been discussed, let me start with a question that you asked through the audience. I think let me think one important thing. When you are talking about, universal access, there are three dimensions. Universal access to healthcare, specifically for women. The first one is quality of health service, and the second one is coverage, and the third one is financial protection. So when you are talking about private sectors, we are talking about the financial protection, because the out-of-pocket money, if go beyond 10% of the household expenditure, that will lead, women into poverty. Right now, more than 50 million women and people in Africa, they are, transition to poverty because their, out-of-pocket money is, beyond what, they are, expensing. So anything that from household expenditure, if go more than 10%, it's said, catastrophic investment, which is not. That's why the healthcare insurance, come into picture. So from that point of view, the healthcare insurance is a critical component that private sector can be leveraged or just linked with. There are some African countries that have very strong, partnership with healthcare insurance with the private sectors. Others, for example, in the case of Ethiopia, the private sector engagement, the private sector relation with, the healthcare insurance is not as such strong enough. So that means in order to bring that kind of platform, we have to think of, the resilient, the private sector approach that will lead private sector to harness from the insurance scheme, and the insurance scheme also supporting, the women, not just to protect just to ensure the financial protection. So yes, definitely awareness is very important. Why we need to have an insurance system with the private sectors? How the private sectors, existence can be leveraged in order to protect the financial, hazards that women or young ladies are suffering. So for example,
Oh, I think is it just me or is it? I think our moderator is internet.
There's a problem with connectivity.
Okay. Oh. Apologies. Well, I'm gonna just take over for a second, and I would like to thank everyone already for this amazing session. I would like to thank our chair of the coalition, Mokadi Mashishi, who has brought all the points across so beautifully. Nyawira, thank you so much. Also a founding member of the coalition through Logic. Thank you very much for your absolute important points. Dr. Sarah Malaba, thank you extremely for being a partner of the coalition. I think your organization brings value to the women's and girls' health space within Africa through access, which is absolutely crucial. And Ruth Field, thank you very much from AstraZeneca for also giving your views. I am just going to do some end remarks, but I hope still Dr. Abebe will be able to join. If not, then we will all provide, of course, a very detailed side session report, and it will be published so we can bring out the highlights to everyone and make sure that everyone can see what we discussed today. To all the attendees, thank you very much for attending. Very much appreciate to have you here in our discussion. And thank you very much to the IT crowd who obviously makes all of this happen. To also mention briefly, obviously this was an official side session of the CPHIA conference that will be held in person next week from Monday to Wednesday in Lusaka, Zambia. With the theme redefining the role of Africa's healthcare space, which is super important, also based on the new public health order with the 5 pillars. And number 5 is very crucial to us, which is private-public partnership. There we go, respectful, action-oriented partnership to advance vaccine manufacturing, healthcare workforce development, and strong public health institutions. And I think that's also why the Coalition for Women's Health really wanted to be part of this discussion, to make sure that we show that the private sector also would like to hold hands together and create change in the women's health environment. Africa Health Business is the secretariat of the coalition, and they also have next week 2 more sessions that will be held in Lusaka, and I'm just going to show it here. So for any attendees who will be attending the conference, we have the Africa Health Business and Pfizer collaboration session. You can scan to register there. It's about action-oriented, respectful partnership for public health in Africa, which is, again, Pillar 5. Partnerships for access to medicine. It will be held on Monday, November the 27th. And then the next session is a session that will be accelerating universal health coverage by leveraging the private sector. This will be hosted as well by Africa Health Business, Health Strategy and Delivery Foundation, and the McKinsey Health Institute. I've just seen also that Nyawira has posted in the site comments. Please, other speakers, if you would like people to contact you, you can put your email address there. I think that's a very good idea, because there was more questions, and I will forward them to you personally. Additionally, we want to already highlight the next Africa Health Business Symposium in 2024, which will be held in Ghana, Accra, which is a focus country of the Coalition for Women's Health in Africa, and we will be co-hosting it, all about advocate, act, and advance. So I also would like to welcome you to visit the Africa Health Business website to look more on this and register if you can. I would like all the speakers to have one more comment and parting shot. So I'm going to start with Mokadi, the chair of the coalition. Please, could you give a 1-minute parting shot to our audience and us, please?
Thank you. So from my side, thank you for joining us. And my parting shot would be, as Organon, we remain committed to improving the health of women on the continent and globally. And for me, the African proverb that sums it all together in terms of from a coalition perspective, but also respectful partnerships, is that if you want to go fast, go alone. that if we want to go far, go together. And along with that is the message of Ubuntu as well as the message of unity. Thank you very much.
Thank you very, very much for your valuable insights and your time. Nyawira, please provide.
Sorry for interruption.
Don't worry. We're doing, Dr. Abebe, I'm just bringing you up to speed. We're going to give the parting shots now. I've given the end of the session. Apologies for your internet connection. Nyawira, over to you.
Sorry, Esther, we have an echo from your side. I don't know. Yes, now that's better. Yeah, great. Thank you very much. So, I mean, I know we have come so far, so it's not like we are starting from ground zero. There's a lot that's been achieved. We're not where we want to be, but we are slowly making the steps to actually get us to improving women's health on the continent. And for me, that's what's most significant, and this dialogue must then continue. Critically for me, listening to all we've had here, I know we talk about preventive promotive health. It's not a nice to have, but it's really a true pathway for us to get financial sustainability and improve the well-being, not just of women, but essentially of Africa's population going forward. So thank you very much for the opportunity, Esther. And this discussion must continue because building on women's health is truly improving society's well-being.
Absolutely. Thank you very much. Sarah, please, could you pass a parting shot for us?
Yeah, my parting shot, which is also a big takeaway from me from this call, is around thinking through and instituting innovative financing and service delivery models that will ensure access to healthcare for women in Africa, especially adolescent girls and young women who are hardly hit by the burden of disease and also hardly hit by access issues. Thank you.
Thank you very much. Ruth, please provide us with a parting shot after this amazing session.
Thank you, Esther. So for me, I think my parting shot is that we're not about medicines. We are about access to healthcare and the entire ecosystem that actually enables that access to healthcare. And the other thing that we need to think about is that we need to make sure that we use healthcare to be an enabler in growing our economies in Africa.
Fantastic. Thank you very much. Dr. Abebe, last but not least, our fantastic moderator. Thank you very much. I think it's an echo from Dr. Abebe's side.
Okay, thank you very much. There is echo.
Yeah, it's from your side, Sam.
Is that from my side or from that side?
Yeah, it is from your side, sadly. IT has informed me.
Okay, so thank you very much. Just the session was very, just give me.
I'm going to allow him 2 more minutes because our moderator, it would be great to hear him say his goodbyes and his parting shot. But let's see if he, yes.
Yeah, thank you very much. I think the session went well. I don't know.
Dr. Abebe, apparently there's 2 devices you have the sound on. If you mute one of the 2, the echo should disappear.
Yeah, because there are different here.
Oh, apologies.
Okay, Sarah, you can't, I mean, Esther, you might, okay, am I audible now?
There is still an echo. I think, Dr. Abebe, what we will do is we will get a parting shot from you in writing, and we will post it on the Coalition Women's Health in Africa's LinkedIn page, if that's okay, and on the website, and obviously on all of you as well.
Is that okay now?
No, it's still a very strong echo. Apologies. Really sorry, Dr. Abebe. But thank you for all the fantastic moderating you've done today. We would like to ask the participants to scan this QR code to give a feedback form to make sure that we can improve our sessions as we go in the future. There is a few more coming up in the beginning of next year. So yes, please fill in so that we can provide the best possible webinars for you. Again, all the speakers and moderator, thank you so much for your time today. As the Coalition for Women's Health in Africa, we appreciate all the partnerships, collaborations, what we stand for, to enable women's health, girls and women's health in Africa. And we couldn't do it without our members and our partners. So thank you all for your continuous contribution. Thank you very much. And I would like to conclude the session hereby.
Good. Thank you, sir.
Thank you, everyone. Bye.
Thank you.
Thank you. Bye for now.
Thank you, everyone.
Thank you, everyone.